I'm going to start out by introducing Lauren Dowden. Lauren Dowden is an MSW candidate at Loyola University of Chicago. She's also a faculty member at the renowned improvisational theater company Second City in Chicago. Lauren, will you tell us a little bit more about yourself, please, and welcome.
Thank you. It's great to be here. Yes, so right now I'm currently getting my MSW at Loyola with a specialization in gerontology, health, and mental health. And I've been working in improvisation probably now for over 20 years, and I've been with the Second City since 2003. As a performer, writer, and also as a teacher. And as of late, I started to merge the two worlds together. So what my experience has been is trying to incorporate improv into more of a therapeutic setting. So while I've used it as just teaching students improvisation, I started teaching improv for anxiety at the Second City. I teach also improvisation for those in recovery programs, so substance abuse. And I also developed my own curriculum and have started working with clients of mine who also have physical disabilities and or mental illness, and establishing an improv group with them, developing both their social communication and cognitive skills. So that's been really, for me, just really profound in terms of seeing how improv can teach and reach out to so many different dynamics in different areas. Right. There we go. But that is, right now, that's pretty much the work I've been doing, is trying to see exactly how improv can reach out to those different areas. And my hope is that I can also start to work with older populations and incorporating improvisation into that area as well. So with that, I believe that is, for now, that's my explanation of what I do. I would like to now pass it on to Stephanie Draus, who's a doctor in naturopathic medicine. She's also an assistant professor of clinical science at National University of Health Sciences in Lombard, Illinois. And while she's a naturopathic doctor and a professor, she also has an extensive creative background, both in writing and in performance, and I know she also has a great deal of improvisational experience. So I now introduce Stephanie Draus.
Thank you, Lauren. Just to give a little bit more of my background, I have been, long before I decided to go back to school for medicine, I was a performer, a dancer, and an actress, and most of my performance experience was improvisational. So I found that when I was studying medicine, part of what I looked to help me understand how to approach patients, I kept falling back on improv exercises. And now that I'm an instructor, I find that the improv exercises are one of the best, quickest ways to teach my students how to interact with patients. In essence, how to be human in the room with a patient. So I have found myself for years now coming back again and again to this work. And so I was thrilled to discover Katie Watson's work and to be able to take the training that we all shared, most of us shared in June at Northwestern with Katie Watson, was really a culmination or a bringing together of two worlds that I was straddling but didn't know that so many people were sharing those areas of expertise. So I've been really pleased to be able to use my skills to enhance patient communication and educate my students and work with my patients. Okay, so I would like to introduce Dan Sipp. Dan is an actor and improviser with over 25 years of experience and a standardized patient actor for Duke University Medical School and Elon University. Dan serves on the Patient Advocacy Council of Duke University Hospital System. So Dan, welcome. Good to see you again.
Thanks, Stephanie. Thank you all so much for having me and for letting me be part of this panel. It's a great group, and I'm thrilled to be working with all these folks. So yeah, I do a lot of work at Duke University. I've been a standardized patient actor for about 7 years at Duke. And what I'm interested now in doing is sort of expanding my role in helping to teach patient communication. I think right now I've mostly been stuck in a role where I'm merely an actor that comes in and performs cases that have been given to me by the medical school. And I've noticed in my experiences that everybody that teaches medical communication is a doctor. And my interest is if Duke in particular has this strong emphasis on patient-centered care, is it possible to bring the patient voice more in the training of medical students or any kind of medical learner? So I'm hoping to expand my role. I have a great deal of experience, 15 years of experience teaching improvisational theater at the I.O. in Chicago, and my own classes and workshops around the country. So I'm wondering, if it'd be possible to expand what we see as a teacher of medical communication. Is it only coming from the doctor perspective, or can we also have a voice for patients and families in teaching that point of view? So that's my particular emphasis right now and what I'm working towards. And that's about it for me. So I'm going to go ahead and pass it on to Nancy. This is Dr. Nancy Smithner, and she's a director and an actor and a professor of educational theater at New York University. She's also been a clown doctor for children in pediatric settings. So welcome, Nancy.
Thanks. Thanks so much, Dan. Can everybody see me on the screen? Okay. Yes, I am an associate professor at NYU. Otherwise, I've been teaching improv for 30 years, and I consider improvisation to be an art form in itself. That's what I tell my students, but it's also a way of life to live improvisationally. So at NYU, in our educational theater program, we have a focus on applied theater, which is actually working with vulnerable populations. And in that, I had an additional job for 20 years working in pediatric settings as a clown doctor. And in that role, we had to improvise every minute of the day. Going into each room was different, each clinic was different that we performed in. But more importantly, I like what Dan says about giving the patient voice, and also the notion of attentiveness. The biggest gift you can give anyone is attention, and attention to self and attention to others, and being aware of the setting. I think in a healthcare setting is so multifaceted. There's so much going on that if we can work to bring improv more into our human arena, into our personal skill set, it's very exciting. And that's why I'm really interested in the work that Beth is doing and Stephanie. So I'm sure I could say a lot more about it, but let me pass it on to Richard Snyder, who is a practicing anesthesiologist and a trainer and facilitator, and also a creative artist. He just won an award for his film on the nature of hotness, which won Best Comedy of Short Film at the 2013 New York City International Film Festival. So that's really exciting to bring the notion of comedy in. We're hoping that Rich will tell us something about the hotness of medical improv.
I can only be hot if you can hear me. Can you hear me? Yes? Oh, cool. I think hotness in the clinical arena is being a master clinician, and I come at it from the medical end first and the theatrical end later. And in the medical end, I speak for all physicians everywhere. I can do that right now because I'm on Google Hangout. We want to be masters of what we do. We want to be experts. We want to be at the level of an Olympic figure skater in the clinical arena. And technically, the educational programs are really good for giving us those technical skills. What's lacking right now, as far as I can tell in my own personal life, I think, and in all of ours, is a really defined curriculum for giving us mastery of human interaction and communications, which, what I've learned in the acting world, already exists. The training programs are already there. So I am in agreement with everyone else that there's this marriage potential between this medical world and theatrical training, of which improv is a critical element. And what I've been doing with it is working with simulation centers, which is a natural for me, being in anesthesiology. And I view simulation centers as a learning environment in medicine in which one can simulate patient encounters or one can simulate operating room interactions. But what we don't have in those arenas right now is foundational skill training, which is what, to me, what the improv is all about. And an analogy to athletics is that if you want to be a great figure skater, you've got to go to the gym and be in good cardiovascular and strength conditioning. I view the improv work as foundational, like that work is, and then as one gets, you have to have that before you can go to the next step in your training and actually have real clinical interactions. And that is what I'm trying to do, is take this material out in that way. And now passing it to Toby, who I see in my right-hand corner. Hi, Toby. Who went to NYU, theatrical major person. They just popped up on my screen and just focused with this really cool, like, Egyptian background or something. And so he comes, as far as I can tell, to this world from the theatrical end first. And I worked with him in Chicago at the Northwestern training with Katie Watson, like many of us. And he is a wonderful man, a charismatic actor, and is now in San Francisco training to be a doctor at the beginning of what will surely be a great career. Take it away, Toby.
Thank you, Rich. Everyone can hear me. Is that true? Okay, great. Yeah, I'm at the beginning of what will surely be a great career and a long education. And I've come from a theater background. My background is from NYU, and I studied theater there and directing and acting in many different ways. And I was really excited by the experience that I had with a number of you in Chicago, because I found out that there are many people sort of doing work that brings together what has been sort of my past and what I'm excited to be my future. And yeah, I agree with you, Rich, that there are exercises that exist to build these skill sets. And I've done them previously in my undergrad, and it makes a lot of sense that if you want to get better at these things, you can do these exercises. But looking forward, just from my perspective as now like a post-doc pre-med student, I have a lot of chemistry classes to take. I've got a lot of math classes to take, but they're not necessarily in my curriculum right now. So I think there's a really exciting opportunity there for them to be there, because I agree with you all that they are really valuable, and I found them valuable in my undergraduate education. So I could say more, but I'm going to go ahead and pass it back to Beth now, I think. Is that all right, Beth? Okay.
Thank you, Toby, and
Sure.
thank you. Again, I'm just in such a moment of honor and pleasure to be with you all this morning and to share this vision, even with our different slants on the vision, of just how valuable medical improv can be to our healthcare systems. Stephanie and Lauren are going to play this game called Yes and, Yes But, and No. And the instruction is basically that they're going to have a dialogue about finding a parking space in the city. And Stephanie will start out, and every sentence that they use, with the exception of the first one, will begin with yes and. So please take it away, Stephanie and Lauren.
Thank you, Beth. Hi, Lauren.
Hi, Stephanie.
So every time I try to come downtown on Saturday night, it's such an issue to find a parking space here.
Yeah, and every time I come here on a different night, it's still difficult to find a parking space.
Yes, and I'm not sure when, the city's going to get a handle on this.
Yeah, and I heard they're going to raise the parking fees in the city.
Thank you, Stephanie and Lauren. Yes, the quality of that conversation, you can see how they're validating each other and they're building a conversation about parking. They're in alignment and they're respecting what each other's saying. So they're both listening to each other and they're both adding to the conversation. That's why it's called Yes and. Now let's have them do another conversation for us. Talk about birthday parties, if you will, and the difference in this conversation, and we'll have Lauren start, if you will, this time. But with the exception of that first sentence, every sentence must begin with yes, but. Take it away.
Hey, Stephanie, I was thinking for your birthday, we should go on a trip to Europe.
Yes, but I really can't afford to go to Europe.
Yeah, but it's your birthday, and I think you should do something really extravagant.
Yes, but I'll have to check and see if it'll work with my schedule.
Yeah, but I mean, that just means that we're going to put it off for another year, and then it won't be your birthday anymore.
It's really fun to debrief that with a group of peers that have just experienced this difference between what it's like to feel heard and validated, between what it's like to maybe be heard, but some challenges in that. And the quality of the conversation goes in quite a different way. Now let's do it one more time with no, and we'll bounce back to Stephanie and ask you, Stephanie, if you would start us out with a conversation on horses. And each sentence following will begin with no.
I went horseback riding last week, and it had been 10 years since I had been horseback riding.
No, it hasn't. You just went 2 years ago with me.
So you can see how quickly that conversation comes to a halt, and the team building efforts have gone awry. So thank you very much, guys, for doing that activity. We're going to do now. We're going to demonstrate some status games, and again, please know that this requires a fair amount of experience in improv, because I'm not going to teach the game. If I were teaching it, we would probably take quite a bit longer in order to get to a place where folks would be ready for taking this on. But I know that this panel is experienced and ready already, and this is more of a demonstration for us. And just to preempt that with the importance of status in healthcare, if you think back to the issue on respect and the relationship pieces, high and low status can carry both positive and not so positive consequences. And if the more we can be aware of as individuals on how it feels to be in high or low status and what we can do to try out different ways of being in relationship with each other, can make all sorts of difference. One quick example is a physician that I know shared with me that he, after practicing some status games, was able to manifest a lower status when he was in an interview with a young woman who had just been raped. And he did that very intentionally to help her feel safe in that interview process. So we're going to have some fun with status games, but the application of this play is quite serious. So I'm going to ask Stephanie Draus if you would play this game with Rich, the one-upmanship game. Do you remember that? I actually learned it from you, Stephanie. And Rich, I think you were there for that. Basically, what the activity is that in your dialogue together, you are going to keep upping the ante so that each one of you is trying to be better than or higher status than the other one. Are you with me? So let's
ready.
Okay, awesome. Let's put you in a restaurant as colleagues. And folks watching, if you just pay attention to the different ways that they're exhibiting, how are they exhibiting their status? Take it away.
This is the best meal I've ever had.
Well, I'm not so sure about that. You know, I was in Paris last year, and I was at a one of those five-star Michelin restaurants, and I would say it was even better than this one.
Well, you know, that reminds me of the time you and I were in Milan eating dinner, and you did not know the name of that appetizer they brought us.
I was pretending to not know the name because I was wanting you to feel a little bit more comfortable with yourself.
Oh, that's you, but you must have forgotten that I invented that appetizer.
Well, you may have invented that appetizer, but it was my idea to go to Milan in the first place, and it was my idea to order that appetizer in the first place, too.
That's true. I did invent it in honor of you because I felt so bad that you came in second in the international cooking competition.
Well, you know, second place, silver medal, and I'll be there next year, but you weren't even in the competition.
I was really sorry to miss it. I was having dinner with James Beard that night.
Well, I was too busy to have dinner with James Beard because I had just opened up my first restaurant in New York City, East Village, and we had a 4-hour wait for people to come into the restaurant.
I remember that little place. We used to go there on break from my place on top of the World Trade Center.
And you saw what happened there. I just add a little bit of distaste to the equation.
Yes.
So let me interject. Thank you both. That was so wonderful. Some of the little innuendos of the little restaurant and the 4-hour wait and the clever language that you used and being polite and yet still upping your status was wonderful to see. And now, so thank you both. Now I'm going to ask if Toby and Dan, will you do a status slide for us this morning? Now, I need to know that you both know the use of that term, that you will start out with one status in a dynamic in a relationship that I'll give you in just a second, and over the course of your dialogue, you will decide on your own when you're going to switch and gradually take on the other status. Is that enough instruction for both of you?
Sure.
Okay, so I'm going to ask if you will start out with a teacher-student relationship. If Dan, you would be the high-status teacher, with Toby, who's having some attendance issues. Take it away, Dan and Toby.
Well, Brian, thank you for taking some time out of your very busy schedule to come meet with me today.
Yeah, you know, I could clear a thing, so I thought I'd stop by. You wanted to talk to me? What?
Yeah, Brian, I'm concerned. I'm just going to say it right out. I'm concerned about your attendance in my class. You understand that attendance is mandatory.
Yeah, I think I heard you mention that on the... Well, it wasn't the first day, because I skipped the first day, but I definitely remember hearing you mention that at some point. That's great that you feel that way.
Brian, I'm concerned that if you miss any more sessions of my class, you could fail this course. And I don't know what your father would say. You know, your dad and I go way back, and I think your dad would be pretty upset with both of us.
Yeah, I had forgotten that about you, you and my dad. You know, it's funny. I do remember what day that you mentioned that because it's a Thursday, and I do have Thursdays free in the future. So I'll probably see you next Thursday if you'll still be having class then.
Absolutely, Brian. That would be great. I would love for you to stop by. You know, I didn't mean to come on so strong earlier. You know, I didn't want to be. I'm not trying to be the bad guy here. I'm concerned about your success at college. We all want you to graduate. We think you're going to have a great career.
I will because I've got such a great teacher. I just want to let you know that I really appreciate your interest in my education. And I think your class is fascinating.
Well, that means a lot, Brian. Wow. Hey, tell your dad. Tell your dad I said hi, and
Yes,
and then
sir.
we're working together on this, okay?
Yes, sir. Yes, sir. Thank you, sir.
Wow, I feel so much better. Do you feel better?
Kind of.
Thank you both so very much. And I hope that folks watching could see some differences in how each Dan and Toby were talking, and how Toby's sort of nonchalant, high status student persona there was a change in how he was expressing himself, how he stumbled on his words and used more words, and Dan became more clear in his language, and sorts of things that we start to notice about ourselves and each other and what status looks like and what it feels like. And there's lots of debriefing that can take place in a classroom with students to ask them, how did that feel for you? Do you have a status that's more comfortable for you? What if you are in a situation where you might need to present a different status? For me, as a nurse, that might translate into practicing assertiveness, and I might actually use some improv to slow down my speech and to move more with more ease and less fidgeting that can bring me into a higher status.
I'm really sorry. I had a flat tire on my bike coming here.
That sounds hard, but thank you for coming. Won't you sit down?
Yes, thank you, Doctor.
What would you like to talk about this morning, Nancy?
I just have been feeling really awful about myself, and I can't get over it.
I'm sorry to hear that. We'll see what we can do to help you feel better in today's session.
Well, maybe you could give me some advice for a change, instead of just waiting for me to talk and just sitting there.
I could try harder, I think, to give you advice that will actually be helpful to you. I'll try.
Well, what would you suggest that I do then?
Well, maybe I could get you some help to help with social services that will maybe help you with getting your car fixed. I don't know. Would that be helpful to you? Maybe it's just silly to even think that.
Well, I'm paying a lot of money to come here to see you, and I would think that you would be able to answer my questions.
Oh, you're so right. I feel I could do such a better job. I really, maybe, I won't need your money this morning. Obviously, you're bringing so much more value to our session. I don't know what to say except to just apologize. I probably shouldn't even do that. I'll probably lose my license or something, or I should lose my license.
Well, I think you should apologize, and I think if you did that, I would go out of here feeling really good.
I am so sorry. Will you please ever forgive me?
Well, since you've apologized, I won't hold you to losing your license this time, but I don't know if I'll be back next week.
Mm. Thank you for doing it's so fascinating to me to feel how I change, how my voice changes. Who am I when I have a higher status? And watching you, how astutely you use a pause, a moment to just let nothing be said. And this is so rich in that pause. Okay.
First, that was great, everyone. Beth, the first question that's come in is this. I had a medical crisis and felt disempowered in the hospital. how can medical improv work for the patient?
Well, I think that it may be more indirect at first, but I think as healthcare professionals become better at our own communication skills, we will become much better at empowering others. Sometimes we teach assertiveness by saying, what do you need right now, and then listening to the answer to that. Empowering patients can come indirectly through our developing our own communication skills, but I also see potential for having medical improv classes that combine both. And would not that be a wonderful vision where patients, not when you're sick, that's probably not going to be the best time to learn to speak up, but if we can prepare you beforehand. So we'll listen better, that will help, and then who knows what can happen in the medical improv. And does anybody else have a comment on that question?
Next question that's come in, probably directed more towards our theater professionals, is what advice do you have for someone who's a beginner or wants to learn improv?
This is Lauren. Hi. I can start to field this question. I think the best thing you can do is follow that instinct and take a class. I don't know where the question's coming from, but a lot of cities now are providing improvisational classwork. Almost all the people I used to work with here in Chicago have now moved on to other cities and have started developing their own improvisational theaters. So hopefully there's a place where you can take classes and begin that journey.
Great. Thank you, Lauren. Does anyone else have some feedback there? Any additional advice?
I might also say that if by any chance you happen to be in a place where classes aren't accessible to you, there are a number of really good references that you can find of books of sort of exercises that are some of sort of the games or exercises that are used in improv that you could feel free to sort of try out with a group of peers, and those can be found pretty easily.
Yeah, and to piggyback again, really quickly, this is Lauren again. If you are not in an area where there is improvisation classes to be had, also there's intensives going on around. I know some colleagues we worked with at the Train the Trainer came to Chicago for sometimes a 2-week intensive. And you can work with the Second City, you can work with Improv Olympic I.O., The Annoyance. So there's theaters all around that do intensives all the time. So if you don't have it around you, you can go maybe find it somewhere else and have maybe a great 2-week or so experience.
And I wanted to add also that might be something for us looking forward to create some kind of a network or a list that people could go to around the nation with suggestions for improv. That'd be something we could look forward to work on.
Excellent. Thank you. Thank you all for responding to that. Another question that's come in for our physicians. We've described a few ways today of how medical improv is being used, but from your perspective, how does medical improv further develop physician leadership, especially at the executive level? Your thoughts?
I'll start, if I can. This is Stephanie Draus. Coming from the complementary or alternative end of medicine, I'm a naturopathic doctor. I have found that being able to understand how status works and to recognize it when it occurs both internally and in an interaction can help to begin to jump some of the issues we see where people who are coming from the complementary side may feel that doctors on the conventional medicine side do not take us seriously, or vice versa, where some of my colleagues in conventional medicine may worry that my colleagues in alternative or complementary medicine are setting we're playing the us versus them game, that we see each other as enemies. And the first thing you need to do is recognize the patterns we fall into. It's the only way you can change them. If you can say, we're coming into this as equals, and we are here for the good of the patient or for the good of the progression of healthcare, if we're talking in a more general sense and not about a specific patient, then we can meet in the middle. But we need to get over the status issues to build those bridges. I also find being able to listen to what people are really saying and to react to what has actually gone on is a skill that will help you to avoid the assumptions you have about what will happen in that situation.
Thank you, Stephanie. That's great feedback and very valid points. Richard, I wondered if you might have a moment or comment regarding that question.
Couple of comments. Can you hear me? Not heads. Yes.
Yes.
Leadership has lots and lots of aspects, and I've done some physician leadership stuff, and there's lots of trainings out there. But in terms of medical improv and improv in general, I think it's a field that's in early development. However, there are groups that are already doing this kind of work for leadership training in the business sector, and a lot of times leadership in healthcare has to do with the business side of things, and specifically Stand and Deliver on the West Coast and out of San Francisco is run by a couple of improv folks, and this is the aspect of leadership about the ability to get your message out, personal charisma, and all sorts of stuff about outgoing communication aspect of leadership. And on the East Coast, there's a group called the Ariel Group, and they actually has a lot of printed materials as well. So it's something I can't speak with authority on, except to point out that it's ongoing resources available for this already out there.
Excellent, excellent. Thank you for that feedback, Rich. Beth, you know, we've heard a lot and are seeing some comments come through that a lot of people might feel a little bit out of their element with these kinds of activities. What kind of advice or what strategies might you suggest to be used to break down some of those barriers to resistance?
Thanks, Judy. Well, I think more and more talking about it and getting it out in the public will be helpful in terms of seeing the value of the work. In the classroom, making people or helping people feel safe is part of a group process facilitation. And the way I do it, I ask folks to be willing to stretch a little bit, but I also reassure them that staying in their comfort zone is also important too, and that the increase in comfort will be gradually with the experience of improv. And there's actually one of the warm-up activities I do that I got years ago from improv, and it doesn't even involve a lot of dialogue, but it's a great first step, and I'll share that with you because it's fun and it's simple and it builds relationship and comfort early on in a workshop, and it's called I Am. And all you do is you take the words I am on a piece of paper and you write a blank next to it, and maybe do that 2 or 3 times. And I ask each student to fill that in with something that they feel comfortable sharing with other members in the group. For instance, it might be, I am a little bit nervous to be in this new improv class, or I am excited that my son is graduating. I am worried about one of my patients in surgery right now. So those 3 things go on a piece of paper, and then I ask each participant to take it around the room and take a minute or 2 and exchange I ams with some of their classmates. And I usually allow about 10 minutes for that in a group size of about, say, 10 to 20 folks. And it's very quiet initially, but if I just stay out of it, within a few minutes, people are starting to talk together, and they're starting to find that they have things in common or different things that they are interested to learn about each other. Even groups that may be working together every day find out about things about them. So that's I think there's some finesse in deciding what activities to use with what groups, when, and how. Well, thanks for joining us today. This is an exciting beginning, and we welcome all of your feedback, your comments, your ideas, and your questions.